Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Abdomen. We place two ligatures. First, stomach. On the stomach, you place two ligatures or knots at the cardiac end of the stomach and two ligatures at the pyloric end of the stomach. And the stomach is removed by cutting between the ligatures. The stomach is removed. The contents of the stomach should not be spilled out. The stomach is to be dissected along the lesser curvature. First, it can be dissected between the lesser and greater curvature, or it can be dissected along the greater curvature. Test.
thank you and thank you for watching.